Hi, good evening. Thank you all for attending tonight. I'm Laurie Trungone, the service line leader at Inspira for Women's Health. We have a great presentation in store for you tonight. We're using the On24 platform again, and for those of you who have been with us in the past, you know it has lots of fun bells and whistles for you to be able to play with, so feel free to click around and explore and have some fun with it. All the windows on your screen are resizable and movable, so feel free to move them around and get the most out of your experience. You can enlarge the slides by clicking on the arrows in the corners of the windows. At the bottom of your screen, there are multiple engagement tools that you can use. Using the toolbar, you'll be able to download the slides and other resources that we have for you tonight. You can look at our speaker's bio and even register for our next event, which is February 25th, entitled Working from Home in the Pandemic. As usual, we encourage you to ask questions throughout the event using the Q&A button. Your questions will only be visible to the presenters, and your identity will remain anonymous if that's what you'd like. So we hope you'll feel comfortable asking whatever's on your mind. Throughout the presentation, you'll see poll questions pop up on your screen. All of your responses to these questions will also be anonymous, and we encourage you to participate. It's really what makes it fun. Presentation is being recorded, and an on-demand version will be available tomorrow using the same audience link you just used. And we'll be putting it on our Inspira website as well. So let's get started. It's my privilege to introduce to you today's speaker, Dr. Scott Dawson, who provides cardiac care at Inspira Medical Center, Mullica Hill. He's a member of Cardiac Partners, which is a partnership between Inspira and Cooper to provide the best cardiac care to all of our patients. He received his medical degree from Hahnemann University School of Medicine and completed his residency at Emory University. He is a fellow of the American College of Cardiology, the American Society of Echocardiology, and the American Society of Nuclear Cardiology. He specializes in treating adult cardiovascular disease, and you'll find he's a very delightful speaker. So welcome, Dr. Dawson.
Thank you, Laurie, for that wonderful introduction. And I am so excited to be part of this Spirit of Women event this evening. The community of nearly, I was guessing nearly 1,000 we're going to register. We have slightly less than that, but it's fabulous that you've all been able to log in and participate this, and encourage you to share these events with your fellow friends for future events. And a special shout out to Laura, whose mother and beautiful daughter Jenna are in the cyber audience tonight. So I am sorry that I can't go out and hug each and every one of you, but hopefully you're home comfortable, either in pajamas or watching on your laptop or your computer with either your sip of wine or perhaps a cranberry juice or a glass of water to sit back and enjoy, to make this as interactive as possible. So please do ask questions that you have, or save them, as we will have a question and answer period at the end. And I look forward to spending the next hour or so sharing some information that will hopefully motivate you to make you be the best person you can be moving forward. So I'll kick it back to Laurie.
Okay. Very good. Thank you. So tonight we're here to talk about heart disease. Tomorrow is Go Red for Women, which is to bring front and center women and heart disease. I'm wearing red in honor of that tonight. And we have, obviously, our cardiologist here. We'll start right off with a poll question and get you all motivated and see where you stand. So let's ask our poll question. This is a true or false question. Heart disease is the #1 killer of women. True or false? We'll give you a second to answer. Well, maybe more than a second. And see where everybody sits with that. And we'll see
the
where,
good news, no one got any wrong answers.
Let's see if I have to go back and do it again. There we go. Holy cow. All right. Let's see. We'll have Dr. Dawson talk about cardiovascular disease. We've obviously established that it's the #1 killer of women in the United States, and let's get a better understanding of what that is. So Dr. Dawson, what is cardiovascular disease, and what does that mean?
Well, I guess to take one step back first is, as we talk about cardiovascular disease, we also think of it both as heart disease as the main focus, but also means that the entire vascular system. So it involves all of the arteries that circulate throughout your body, including your brain and your arms, your legs, as well as your heart. And it's really the study of plaque, which develops in these arteries, which develops over time and leads to heart attacks, as well as potential strokes and other problems in our circulatory system.
Very good.
Now, for many just people understand that plaque is kind of a fancy term of what we talk about when we talk about development of cholesterol or plaque, where in the first artery on the left, you see that's what our artery we want it to look like, where the blood and the blood cells move smoothly through the arteries. As we begin to age, probably as soon as between our early teen years, there's evidence of at least early plaque that forms. As you can see, the little bit of yellow beginning to embed inside the lining of the artery. And that is actually very microscopic. If you were inside that artery, you wouldn't be able to see it. But over the time between our 20s, 30s, 40s, and 50s, depending upon risk factors we'll talk about later, that plaque begins to grow. And you see the little dots. That's sort of what cholesterol, or the LDL that we'll be talking about, gets deposited in the artery. And what's important is that's what actually becomes eventually a stenosis, as you see in the last picture, where the plaque gets to the point where the blood can no longer get through and can lead to problems in circulation.
So are there different types of cardiovascular disease?
Absolutely. Well, the main focus for tonight's presentation is the idea of that plaque and risk factors such as our DNA and our lifestyle and our diet can lead to blockages. And that's what we're really focusing on tonight, is that those blockages can occur and cause a heart attack. That same pathology, when it occurs in your legs, causes claudication. So that's the pain symptoms you get when you walk 2 blocks and you have to stop because there's a cramp in your leg. It's sort of the same thing as getting a cramp in your chest, but instead it's in your legs. And when that same problem occurs in the brain, it's the underlying pathology of what causes a stroke. So we really want to treat this as a whole person, not just a single organ. We want to focus from your head to your heart, all the way down to your legs.
So why are Americans at risk for heart disease?
Well, I guess unfortunately it's a combination of the risk factors that we have. And unfortunately, one out of pretty much half of all Americans have one of the 3 risk factors, which are including high blood pressure, high cholesterol, or smoking. So some of these are risk factors that we have no control over, and some of the things are which we do have, or which are called modifiable risks. If your parents have a history of diabetes or heart disease, we can't go and change our DNA, but we can change certain factors of how we live our life and how we can be the best version of ourselves.
So what about what's unique to women?
Right. And that's why I say that, we, as a focus for tonight's and for the women in the crowd, is that, there truly are unique differences for women versus just men. So we want to, yes, it's the same disease, but it can occur differently, and the symptoms can be differently, and women face different challenges. There can be, obviously, their effects of pregnancy and gestational hypertension, preeclampsia, and diabetes can be early signs that develop in women that men never have to deal with, as well as polycystic ovarian syndrome, autoimmune disorders, birth control, as well as the hormone therapy related with menopause.
So we know the risk factors are different for men and women. Is the disease itself different?
Yeah, I guess statistically, if you were to look at it, that men are more likely to suffer from a heart attack, whereas women are more likely than men to have a stroke, which can lead to lifelong disability. If it's a simple stroke, may lead to the point that your hand can't move. So now you can't do the button your sweater, do your functional activities. So can lead to significant disruption in our daily lives. But heart attack still can happen in women, so we don't want to overlook that. And this slide sort of highlights that, both men and women can have chest pain or chest discomfort, and that's pretty much the classic symptom. Sometimes shortness of breath is a symptom that the heart's not pumping enough blood, that's having a problem. There can be pain that's radiated to the jaw, to the neck, to the back, to the shoulders. But women sometimes have very unusual symptoms. So it's important for us as physicians and doctors, as well as you as patients, to recognize when you have new or unusual symptoms that sometimes they can be a symptom of a cardiac problem. Feeling nauseous, lightheaded, or unusual tired may be the only symptom that you have, that your heart is struggling and not getting enough oxygen.
Very good. So we're going to ask another poll question, and we have actually questions related to this. So this is going to be very good. This is another true or false question. Cardiovascular disease is genetic, and we have no way of lowering our risk. True or false? Cardiovascular disease is genetic, and we have no way of lowering our risk. And I'll give people a little more time than I gave them last time. And we'll see where we stand and what people think, and then we'll have you address that. All right, let's check. False. Cardiovascular disease, people feel, is not genetic, and we have no way of lowering our risk. So, Dr. Dawson, do our family genes and family history play a role in our risk of heart disease?
Absolutely. And unfortunately, we can't escape our hereditary, but actually knowing what your family history is important because it gives you a roadmap of what is possibly in store for you. So if you have a family history of diabetes, it's going to be really important for you to watch your weight, be able to watch your sugar, probably look for detection of diabetes early because it's the disease, but it's also when the disease goes unrecognized or untreated that causes the problem long term. So there are factors such as high blood pressure, diabetes, and obviously heart disease that automatically put you in a higher risk. And then those risk factors are then amplified by what we choose to do. Unfortunately, some of us, we learn at an early age to deal with stress by smoking, or we all battle with trying to lose 5 or 10 pounds or trying to make a commitment to regular exercise. So part of the message for tonight is that we want you to recognize what you have is your past history, recognize what you can do today so that your future can be the best that you can be moving forward.
That's good. So now that we know that what risk factors are and what causes some of them, do we have any control? How can we lower our risk of cardiovascular disease?
Well, I think that the number one thing is kind of what you're doing tonight. You're taking a first step by just being interested. You're educating yourself. And then the thing is about being an active participant in your own care. The doctor can be with you for 10 minutes, but you're with yourself for the rest of the week and the rest of the month and the rest of the year. So it's really, we all know what we're supposed to do, but the question is, are we able to execute what we're supposed to do on a daily basis? If we have high blood pressure, do we monitor blood pressure at home? If you have risks of, diabetes, have you had your hemoglobin A1C checked? Have you looked at your blood sugar? Have you had that conversation with your doctor about, okay, what are my risks for diabetes? What can I do to prevent it? And, most times the answers are pretty much similar. The issue will come back, you need to increase your activities. You need to watch your carbohydrates. We need to try to maintain our exercise. And also, it's a compliance of medication. Going to the doctor, getting a prescription, getting the pills, but then never taking it, it's not really ever going to help you. It does save on your refills. However, you won't actually be able to benefit from those medications unless you have them and take them and then follow up with your doctor, because we don't want to give you medicines that are going to make you feel worse. The whole reason we give you these medications is to help you feel better and also to make your quality of life better and make you live longer.
So you mentioned lifestyle habits as part of the cardiovascular risk. What lifestyle habits can increase our risk for heart disease?
Well, the things that definitely increase your risk, if you wanted to try to make your life as short as possible, you would load up on all the food that you're not supposed to eat. So you can't go in the grocery store and not see a magazine or a TV program talk about, the dangers of a high-fat diet, because those high fats are the precursors of the cholesterol that gets deposited in our arteries. So, part of preventing heart disease is putting the right fuel and right food into our bodies so that we have the best and most functioning machine. It's kind of, they talk about your body's a machine. If you put bad, cheap gas in it, you get a clunker. If you put high performance fuel in it long term, the engine's going to run better, and that's what we're trying to look for. The same thing, having too much salt. There's not a person in the world that doesn't love the flavor of add a little extra pinch of salt on their food for extra flavor, but that's going to raise your blood pressure. That salt is what leads to the swelling in your lower extremities. It's what causes the puffiness in our bodies. And then simply always, life constantly gets in the way. So getting enough physical activities is one of the biggest challenges we have, because we always tend, especially women, put everybody in front of their priorities, so they'll take care of their family, make sure the kids are good, make sure they're shopping, make sure everything is set up. By the night, it's 11 o'clock at night, and who wants to exercise 11 o'clock at night? So I think what's most important is recognizing that your health is just as important as anything else on that to-do list, and take the time and chisel out an hour 1 or 2 times a week. So, this is my time that I'm going to meet with my girlfriends. We're going to go for a walk, or we're going to go to a spin class, or we're going to spend time together and do something where there's an activity that's going to help make sure that you live as long as possible and as healthy as possible. And then lastly, obviously, smoking. We know smoking really amplifies that atherosclerosis, that cholesterol and high LDL is bad for you, but taking a high cholesterol level and then mixing that with caffeine and nicotine is what essentially triples your risk of heart disease. So, these are all things that are preventable, or things that we could do differently. However, sometimes it's just a matter of recognizing and making smart decisions.
So it sounds like you're saying we definitely have some control to prevent heart disease by living a healthy lifestyle. So tell us more about that.
Well, it's like, if obviously your slide here, weight control. There's people that come into the hospital, they're having a heart attack. They're like, oh, give me a stent, whatever you do. Don't make me lose weight. That's going to require exercise. Give me bypass surgery. Do something to me, but don't make me have to go lose weight. But obviously, it really, that's a reflection of what we need to do as the individual. We want to be the ones in charge of our health by being active, by helping to watch our weight, which then affects your heart disease risk, your blood pressure risk, as well as your diabetes. So weight loss for those that have a BMI over 30 is important, because we know the higher BMI, which is your body mass index, is proportional to your risk of developing heart disease and diabetes down the road. So there's lots of times I'll see patients in the office who, they want to know they're on the border of diabetes or the borderline of needing extra medications. And really the choice comes down. You can either sign up for more medication, or you can take an active role and try to lose that 5 to 10 pounds. You can try to increase your physical activity, which will lower your blood pressure, perhaps reduce the risk of diabetes, or at least slow the progression. So I like to say, if I'm going to have a heart attack, I'd rather have it after I die, not while I'm living. So the goal is try to push these things off as long as possible so that they're not the cause of what makes us spend more time in the hospital or getting medical care. And then, exercising. And sometimes, losing weight is hard. I personally have been trying to lose 15 pounds for about 15 years, and I have failed every year. And I think I'm pretty darn smart. I've tried everything. So as we get older, our lean muscle mass goes down, so the number of calories we need is less, and as a result, we tend to have more fat and less muscle, which leads to more weight gain. Unfortunately, it's a struggle for many people to try to lose that weight. So there are medications out there that can help to curb appetite and to increase your metabolism, as well as opportunities within the bariatric world. In the past, having gastric bypass was sort of was spoken only in the shadows of medicine. But even at Inspire, we recently developed an entire bariatric and medical weight loss program to address these issues, because by helping people lose weight, we can help prevent all these other medical problems downstream. So, losing weight and taking that first step and saying, what, yes, I want to make a positive change in my life. I want to make the difference. And it really requires you as the individual to take that step, because we can't do it for you. We can do it with you, but we need you to want to be part of this with us. So, those are things we consider for weight control. I know we have some more things to talk about, such as just, we talk about eating, and that's something we all struggle with, because there's people that can eat very well and still have high cholesterol again. And I tell them it's not because you don't eat well, that's part of your DNA. But then there is obviously choices we can make that can make us be the strongest, healthiest version of ourselves. And it obviously includes eating more fruits and vegetables, lean meats. I try to challenge patients probably not to eat more red meat than once or twice a week. Have more fish, which increases your omega-3. I tell people it's possible to go a whole day and not actually eat meat. You can have a salad. There's lots of vegetarian things that you don't have to be a vegetarian, but you can make that part of your dietary selection. Expand your window of things to eat and try to find things that are, healthy. And it's also really fun and really, I think, much easier to do when you do it with a partner. So if you have a spouse or a significant other, that you can do that together, it definitely makes it a lot more fun doing it with somebody as opposed to trying to do it yourself. And then the god-awful quit smoking. So obviously, smoking remains a major problem in our society. And personally, I think that smoking mostly is a source of dealing with stress. It's a mechanism, it's a coping mechanism that we've developed as when we're stressed or frustrated, it incorporates an immediate 10-minute break. Unfortunately, the nicotine and the other components within smoking and cigarettes amplifies your risk of heart disease. And that's our biggest thing. And the other thing is, we know when we look at people who get a heart catheterization that blockages in patients that don't smoke tend to be relatively smooth blockages in the middle of the arteries. And for whatever reason, when you combine nicotine with elevated cholesterol, the blockages almost always occur sort of what we call a bifurcation, where two arteries split. So it makes, not only is it one blockage, but it oftentimes affects two arteries and leads to much higher need for bypass surgery and much more harder interventions when we try to fix these blockages. So when it comes to smoke, we'll go back to that for a second if you can, but just saying smoking cessation is, we as your healthcare providers, we don't want you to do this alone. We're supposed to be here as your advocate. There are ways of medications to help curb your appetite. There are counseling sessions that can go to help you with coping, with quitting smoking, and also helping you cope with what causes you to smoke in the first place. Because I tell people, if you've been a smoker for more than 10 years, you're going to wake up every day and still feel the urge to smoke. The question is, are you strong enough to simply not smoke? And then realize that smoking is not going to make your financial issues any better. It's not going to make your health any better. It's not going to make your problems go away. And eventually, it's simply going to give you more problems. And almost everybody, when they get a medical problem, then they want to quit because now they see the light. We just want people to see that light sooner and understand the risks that they're getting.
Very good.
And then finally, being active. So, and I think that, personally, you're coming from a person who really doesn't like exercise that much, but I still do it because I know that exercise is what's going to help us maintain the functionality of our lives for as long as possible. When I tell people, when they're 20 years old, if they get exercise and exercise, they're still going to be healthy. But when you get to be 50 and 60 and 70, exercise is what is crucial because that's what's going to help you have a healthy and a highly functioning life when you're 60, when you're 70, when you're 80. When I see patients that are in their 80s and early 90s that are still active and traveling and doing their recreational activities, the biggest thing that distinguishes those that are not being active or simply not alive or in a nursing home is the amount of exercise that they've done over the course of their life. So truly having an active lifestyle, which means, a minimum of 20 minutes 3 times a week with a upper goal of 150 minutes a week is really important because that helps promote the health of your arteries, your memory, your energy, and your total body health. So again, there's just we talked about that. Get moving. It just requires, a regular exercise. Try to incorporate it into your life. If you have an opportunity, like they talk about your kids go to gymnastic practice. Well, when they're in gymnastics practice for 45 minutes, maybe you just get out of your car and you take a walk around the building for 45 minutes. Or you make it part of a family activity. On Saturday morning, instead of just sitting at the table while everybody plays video games, make everybody go out for a bike ride and go get breakfast when we can later on. Or spend time taking a hike. Even during this COVID time, there were times I try to encourage people at least to go outside still in your family and take precautions, but go for a walk, go for a stroll. There's no danger with going on a trail with your friends and family and trying to be active as long as you're safe and do it in a safe environment. And then finally, they always talk about sleep. The biggest concern I think for many people, especially for women, is that they're so busy trying to answer everybody else's problems that they don't have the time for themselves. So what gets cut out? Their exercise gets cut out. Their sleep gets cut out. So, it's important that for your body to stay strong, your body needs a certain amount of rest. It allows your brain to recharge. It allows your cells to recharge. It allows your liver to clear all the unnecessary carbohydrates out of it. So sleep is important. And it is a challenge because it feels like maybe it's wasted time, but it's not wasted time because it's what helps your body recharge so that the next day you can make good decisions. When people are tired, they tend to grab the easiest things. They're always running late, so they grab the fast food. Eating healthy takes time, and it takes preparation, and it takes a decision to make that extra effort. And it's harder to do that when you're exhausted all the time.
It sure is. So you've walked us through and we've learned about cardiovascular disease itself. So can you help us understand what an actual heart attack is?
Right. So, that's sort of unfortunately, the most talked about in sort of the epicenter of heart disease. So most oftentimes, a heart attack is when there's a sudden rupture within the lining of our arteries. Our arteries are sort of like the lining of a pool. And sometimes where there's plaque, there can be a point of pressure either because of stress or that plaque ruptures. And then suddenly there is a clot that forms within those arteries. And unfortunately, every 40 seconds in the United States, someone's having a heart attack. And as a whole, over the course of a year, over 800,000 Americans have a heart attack every year. And over 600,000 of them have their very first heart attack each and every year. Oftentimes, some say as many as 1 in 5 heart attacks can occur silent, meaning that patient doesn't get the traditional, oh my God, I'm having this Fred Sanford, I'm dying chest pain, but they may get some shoulder pain. They may get some sudden sweating or shortness of breath. And then the only thing that we ask is that, if you have symptoms that are new or that feel like they could be heart, please come and be evaluated, because we can't help you unless you allow us to at least make that diagnosis. I'd rather you come to the emergency room and be told it's not your heart and send you home than have you wait at home, because as we'll talk about in the next slide, I think time is money. That how long it takes for you to get to the medical attention is how much muscle is at risk for being injured or permanently dying. We can't, after we fix that artery, the muscle that has been killed is never going to come back. So that's why time is such of an essence, because when that blockage occurs, none of the muscle downstream is getting any more oxygen. So as a result, there is tissue lacking oxygen that begins to slowly die off, and it ends up causing an elevation in your blood enzymes, which is what we check when you come to the emergency room to determine if there's been evidence of a heart attack.
So what are the risk factors then for an attack?
Well, I think, it's kind of a summary of things we've talked about already this evening. One, obviously, the older we get, there's a greater chance of having a heart attack. Lifestyle, those that choose that, have an unhealthy lifestyle are going to find themselves at a greater risk as opposed to people that are in a healthier lifestyle. Family history is another major factor that, if everyone in your family has had heart disease, there's a good chance you're going to have heart disease too. The question is, what can you do to prevent that from causing the heart attack? Diabetes is another risk factor, having elevated triglycerides and cholesterol levels. So unfortunately, we all have several, if not one of these risk factors. And the question is, what can we do today, tomorrow, the next day to reduce the effects of these risk factors upon our health?
So that's exactly my next question. Is there something people can do if they've had a heart attack to help themselves recover and reduce the risk of a future heart attack?
Yeah, absolutely. I think, unfortunately, as I talked about, it's kind of a wake-up call when somebody who has smoked for a long time ends up finding they have lung cancer. They all want to quit smoking. When people have had an unhealthy lifestyle and have had a heart attack and realize they could do better, oftentimes they will go to cardiac rehab where they can actually, like this fine lady here, pick up a nice young gentleman who's there working out and obviously learning how to exercise on a regular basis so that it can promote your long-term health and wellness. And then we talk about taking charge of your medical conditions where, as when Laura asked me about this presentation, I said, one message that I'd want to get across is how important it is for patients to be an active participant in their own health care. Because, we can give you instructions, but it's you as the patient that has to execute it. And we want you to be part of it. We live in a world that's all about collaboration. We're just part of the team. We're like your coach sending you out into the field and you have to go execute it. So understanding what your cholesterol is, checking your blood pressure. If you have diabetes, checking your blood sugar, even periodically checking it just because you have a risk of having diabetes is important. Take your medicines as directed and work with the healthcare team. If you have questions, don't just ignore them. Ask those questions because really we're here as a resource. We don't need Dr. Google to answer all of your medical questions. Why not take that 10 minutes you have, whether you're with your physician or nurse practitioner, and share with them your concerns. So I always recommend patients to, make a list of questions. So when you get into the doctor's office, you can make sure the things that you've been thinking about since the last appointment, you have an opportunity to ask them and to get their feedback so that you can understand why you do and why you take the medicines you take, and also understand what you can do better before your next appointment.
So how can people stay on top of these issues?
Yeah, so, there's a couple things. I tell people, if, there's certain things you need to be able to know about yourself to know that you're actually being an active participant. So I think everybody that is interested in trying to prevent heart disease, they should know what their cholesterol is. And we tell people the goal is to have it less than 200. So if I were to ask everybody in this room, I would want to know, I would ask you in the group, how many of you know what your cholesterol is? And beyond that is, how many of you know what your LDL is? Because knowing what your total cholesterol is probably not good enough today. Now we want to know what your LDL is, because that represents the cholesterol that gets deposited within the lining of those arteries. And we want that to be less than 100. We know that plaque formation forms whenever that LDL is above 70. If you can get it below 70, you can halt the progression of disease and sometimes cause regression. You could reduce the amount of plaque in your arteries by lowering that number, but it has to be less than 70. And if you don't know what your number is, then you have no idea what you're doing. So, these are gauges that you can check, and these are tests that your doctor should order. And I imagine they already are ordering them, but it's important for you to understand so that you can then treat them. The HDL is a reflection of your good cholesterol. It's sort of a scavenger molecule. The HDL goes in there and takes out the bad cholesterol, and it's promoted with that regular exercise. So that's why it's important to do those 20 minutes or, up to 50 minutes a week of exercise, because that actually promotes within your liver the production of HDL, which then goes into these arteries and actually takes out the plaque.
So as with everything else these days, we can't get away from the issue of the pandemic and COVID-19. And we've heard a lot about COVID-19 and it affecting the heart. Can you help explain it and give people an understanding?
I guess there's
of
a lot of
that
things.
means?
The biggest concern for COVID-19 is that I think people's fear of COVID-19 makes them afraid of hospitals and going to their doctors. So I think that's the first thing, that but I will tell you that the hospital, especially in Spear, it is extremely safe inside the hospital. So what I hate is for somebody who's having heart pain simply not come to the hospital because they're afraid of what could happen, or could they possibly catch COVID. I would tell you that you are much safer letting us evaluate you for heart disease. And I can tell you that every effort is made to keep you safe from potentially being exposed to other patients that have COVID infection. That being aside, the COVID virus does, for whatever reason, also affect not only our lungs, but it does affect the heart muscle. We see almost in the majority of patients who have COVID infection that are older have an elevation in their cardiac enzymes, which means that this virus is causing a viral inflammation of the cardiac heart cells. So we see patients almost daily because of an elevated troponin, which means there's been some muscle injury. Now, in this case, it's not because of a heart attack. It's really because of an inflammation from the virus, which typically will heal itself. And then the other most important thing with COVID is that everybody knows that during the first week, there's a real concern about respiratory problems. However, in the second week of COVID, there's a big risk of developing clots. And those clots can form in your arteries that cause strokes. They can cause blood clots in your legs, which cause pulmonary embolus. And they can form clots within your heart, which can trigger heart because of this clotting disorder that occurs in patients that have COVID. And if I give one message out to patients in the crowd today, that one, we have excellent treatments for COVID. So today, as you listen to the news, that patients who come to the hospital for treatment for COVID are doing much better with the treatments we have, and also the importance of getting vaccinated so you can prevent the risk of getting the COVID infection. So just to kind of highlight on the COVID part, and unfortunately, I was one of those many people out there that end up having bad COVID infection. So I myself ended up hospitalized, and all the symptoms you see on the slide. I had the extreme fatigue, the fatigue that you can't even imagine. So I think there's almost like a club of COVID recoverers that we know what it means to have this, because people talk about fatigue. You don't know what fatigue is until you've had the COVID fatigue. That lasts for months even after the acute infection. It causes trouble breathing in the acute phases. It causes some swelling and can cause some chest pain because you just can't seem to breathe. And so my biggest recommendation again for anybody is if you think you have symptoms, the first thing to do is get tested. If you are tested positive, please don't try to do this alone. Reach out to your healthcare providers, because there are therapies out there now that are being administered even as an outpatient that can almost eliminate the potential risk of being hospitalized. But we can't treat you unless we know you need to be treated. So
you mentioned that people might be afraid. I think it bears saying that there have been no COVID-related infections that have been obtained, that have been gotten in the hospital, at least in our Inspira hospitals, and I'm not sure of anywhere else. But no one has gotten COVID because they were in the hospital. The people who come have had COVID and come with COVID, but it has not been acquired while they're in the hospital. So that's a really important part. So tell us more about some of the testing that you might do and some of the procedures you might need to perform to help get a better understanding of people's cardiac condition.
I asked Laura to include this in our presentation because it's important, because one, to understand what these tests are, because people tend to throw these terms around, especially when they've done their web search and diagnosed everything with Dr. Google, that they come in loaded up with their treatment. They've already decided their mortality, and they haven't even seen the doctor yet. But, there are some very basic tests that we do, and it's important to know what they are and how they work. So the simple thing is just an EKG, which allows us to see the electrical activity of your heart. It lets us know if you're in rhythm or out of rhythm. It also can be a early detector of some sort of previous heart attack. Oftentimes when you go to a heart doctor, one of the first things they'll do will be an echocardiogram, which is an ultrasound, which allows us to look inside your body to see how your heart functions and to see how the valves function. And then sometimes, if necessary, because of chest pain symptoms, we'll order a stress test or a stress echo, which are ways for us to distinguish, are your symptoms heart-related or not heart-related? And then another thing which we've started to do at Inspira is a CAT scan to look at the coronary angiograms, but as well as a CAT scan to look at your calcium score to help people who are younger better determine their risk factors. So it's a way of assessing in the early stages. So, we're really good at trying to help people when they have a heart attack. What we're trying to be is really good at trying to pick up people before they have a heart attack so that we can prevent that heart attack from ever happening. And then that's the kind of the holy grail of cardiology is people who have a heart attack, where we have the technology today to be able to go in through your leg artery or your wrist artery and to be able to advance wires and balloons and stents to open these arteries. And again, our ability to do that successfully is dependent upon the patient's ability to at least have the willingness to come and call at 911 or to come to the hospital for evaluation, because when we do these interventions, we try to make them 60 minutes from the time you walk in the door and are diagnosed with a heart attack. And we know that in terms of fixing an artery, we have to fix it within 12 hours or that muscle damage may be permanent.
So we have several things to do based on our discussion tonight. These are action items, and you should remember to take small steps to make sure that your heart is strong and know your numbers, as Dr. Dawson mentioned to us, for optimal heart health. Talk to your healthcare provider about your personal heart disease risk factors and discuss what you can do to help keep your heart strong. You want to make sure that you identify and treat any stress and mental health issues. Keep your stress in check if you can by taking time each day to try and relax and unwind. Get help if you have trouble coping, because depression, anxiety, or other health problems really can take a toll on your heart. So that concludes our presentation, and we do have a number of questions. So we will take the time now to address some of the questions that have been posed by our audience. So you mentioned the coronary calcium score. One of the questions is, how is that obtained?
It's very easy. So a CT calcium score basically involves coming to the hospital for probably a 5-minute, it basically takes about 15 seconds to do it. And the CAT scan basically goes over the area that your heart is within your chest and will be able to detect calcium, because calcium on a CAT scan is very bright and white. So, and actually I had one done myself this week, because being over 50 and trying to worry about heart disease, so I was able to see early signs of plaque that was there by doing this calcium score. So it lets me know how important that, I may need to be more aggressive in treating my cholesterol. It kind of reinforced my need to maintain a healthy and active lifestyle. So we will use it in patients to determine, okay, you have some family risk factors. And we do the calcium score, and if it's high, we know we sort of have to double down on our efforts to get you to stay healthy and perhaps be earlier in starting therapy or treatment with medications.
So another question, and you kind of touched on this earlier, is about menopause, and does the cardiovascular risk increase after menopause?
Yeah, some people think that, prior to menopause, women sort of have a lower risk, as we mentioned in one of the earlier slides, than men. So men at a higher risk of heart disease. Unfortunately, after menopause, women sort of have a catch-up phase where there's an acceleration. So clearly these hormonal shifts begin to affect sort of the lining of the arteries and may make them more prone to rupture, more prone to, a stroke or other cardiovascular things. So it's important, A, to be able to recognize these symptoms and also to be, available to have these open discussions with your physician, because that any changes in our hormonal levels clearly can affect our circulatory and cardiovascular system.
One of the other questions is a vegetarian diet recommended by a cardiologist to lower cardiovascular disease?
I think that I was a vegetarian for about 18 months, and I think it's a very healthy diet. Most people tend to think of the Mediterranean diet, and I think that, the value of a vegetarian diet is that you avoid a lot of the meats that have a lot of potential hormones and other chemicals that have a very adverse effect on your total body health. My one thing is, when I was practicing with a vegetarian lifestyle, is that you find that you tend to replace a lot of the proteins with carbohydrates. So sometimes you may not lose weight as a vegetarian, but you may be having a healthier lifestyle as you're eating more natural plants and vegetables. And the important thing is being able to get enough protein in your diet. So I think that whether you're a complete vegetarian or a partial vegetarian, I think having a vegetarian aspect to your diet is very healthy, because it means you're emphasizing fruits and vegetables and finding new ways to prepare meals, and you can still have lots of meals. And today, when you go to these grocery stores such as Wegmans and other special ones, there are so many fabulous things that you can make that are truly a vegetarian meal that you would never even consider making unless you were at least open to that idea and that concept.
So one of the next questions is about hereditary factors. I know we talked about the fact that there is a definite hereditary link to heart disease, but how about other things like diabetes or AFib? Two people have asked that.
Absolutely. I think the hereditary link is just as strong for all of those, that patients have a family history of heart disease or diabetes and atrial fibrillation are definitely at a higher risk than other patients for developing those same diseases. So I think that, we all can use our parents as sort of a mirror of what we're likely to become, unless we make changes to prevent those things from happening. So, and even for cancer, it doesn't go just to heart disease. Cancer is another one that has a significant, strong family hereditary linkage. So you can use your parents' history sort of as a guidepost or a guide map of what could happen to you, and things that you need to be more aggressive screening for, and things you need to be more aggressive trying to prevent.
Is that true with AFib as well?
I think absolutely, that people who have AFib oftentimes have a family member that had AFib before them.
And how about the swelling that you mentioned with COVID? Where is that?
Well, most people think about swelling. It's, when people think about swelling, they tend to think of it in your lower extremities. And swelling is such a kind of a general term, but usually it means that the right side of your heart is having problems pumping the blood through your lungs, that the lung pressures are elevated. So it can come from a pulmonary infection, it could come from heart disease, it could come from, even sleep apnea was a thing we didn't really cover in this presentation, but it's probably also a risk factor for heart disease and for swelling, are all things that raise the pressures in your lungs, so it makes it harder for the blood to return back. So as a result of gravity, it tends to pull in your lower extremities, your ankles, your calves, and we're also in fact affected by the amount of salt in your diet too. So those are all symptoms that something within your system is not in balance.
How about, we hear a lot about statin drugs and things like that. Is that something we should be doing, and how do we know if we should do that?
I think that the statin drugs clearly have been shown to be beneficial in helping people live longer. And that's a direct reflection that the statin drugs tend to lower your LDL. And we know that the lower your LDL is, the less chance of having future cardiovascular events. And it is true that over the past 2 decades, we've sort of having a moving target where we want your cholesterol to be under 240, then we want it to be under 200, then we want your LDL to be under 160, then it's under 130, now it's under 100. And actually we set the goal now for people who really want to do the best they can at 70. And we know that sometimes you can't get to 70 or less without medication. So the statin drugs are probably the #1 prescribed drug to lower your cholesterol. And obviously there's lots of people who have side effects. So there are a growing number of alternatives, medications that are injectable that can help dramatically lower your LDL, as well as other newer medications that can work to lower. So it's important to get your cholesterol checked. If it hasn't been checked in the last year, I would challenge and expect every one of the participants in the crowd tonight to at least know what their cholesterol is by the end of the year. They owe that to themselves. They owe that to their family to know what that is. And then once they know what that number is, then they can figure out, is that something they can fix themselves, or do we need medications to bring that number down?
So in talking about the medications, is it whether it's medication for high blood pressure or the statin drugs or whatever medications we're taking for our hearts, once we start them, are we on them for the rest of our lives?
Probably, unfortunately, that you're going to probably be on them for a period of time, only because their goal is to help you live longer. Now, if you make a dramatic change in your lifestyle, there are patients who can come off of their blood pressure medications when they, lose 20, 30 pounds, or they've been able to, make significant weight loss. They can reduce the number of diabetic medications they take, or they may be able to reduce the dosages, or in sometimes stop it. But, I would tell people these medications are not the enemy. The enemy is the heart disease, the diabetes, the dying, the heart attack. That's what we're trying to prevent. And unfortunately, all of us are getting older. So if you had a way of either changing your DNA or perhaps reverse your aging process, that would be great. But until we come up with that magic trick, these medications can help us be biologically as young as possible as our chronological age goes up.
That's great. So I'd really like to thank you very much for taking the time tonight. I'm sorry. There's 2 more questions that have just come through. What about taking aspirin?
That's a loaded question, aspirin. And there's been some news out in the media, and that is probably true, but you have to be very careful when you read the story that was out about 6 months ago. Basically, they said, the newsflash says, oh, you're a doctor, maybe you don't need aspirin anymore. Stay tuned after the break. And basically the article said that if you have no cardiovascular risk factors, that there is no benefit between the ages of 50 and 70 in taking a daily aspirin. So if you have no heart disease, no diabetes, no high blood pressure, there is no documented evidence that taking the baby aspirin is going to help you live longer. However, if you have a history of atrial fibrillation, you have a history of heart disease, you have a history of diabetes, that article didn't apply to you. So there is a role that taking baby aspirin can help reduce your risk of a stroke, mostly first, and also secondly, may help reduce your chance of a heart attack.
So the next question is really, where do people start? Like you mentioned, getting an EKG. Do people just schedule themselves for an EKG, or how do they even start in this process?
I think the first place you start is what you did tonight. I think everybody here has already made it past the starting block. Now, the next step is when you go and you make an appointment with your family doctor, or you can even make an appointment with a cardiologist such as myself. I think anybody over 50, by just being 50, you warrant at least an evaluation to set what is your baseline, so you know where you are as a benchmark for future. So you can start off by going to your family doctor or to a cardiologist, and depending upon your risk factors, they'll start off by ordering your blood test. They'll have a conversation about what risk factors that are modifiable, which risk factors in your history that are part of your hereditary and your genetics, and then they can help guide you by giving you advice about dietary changes. They can give you advice about your cholesterol. And if you have symptoms or risk factors, there's the role of ordering that calcium score or getting a EKG at pretty much at a minimum. And then from there, additional testing based upon your history and other risk factors. So, most people at the age of 50 go get a colonoscopy. I think by the age of 50, probably most people at least get a treadmill stress test to see what their level of fitness is. It also serves as a benchmark for future. and it's also sort of investment in your own health and your wellness.
Okay.
And then tomorrow I would tell everybody to do at least a walk. Take a walk, when the weather gets a little bit better, do something physical, whether it's inside watching a video or going to the mall and walking, or if the weather gets a little bit warmer for a couple of days, just taking a 10-minute walk outside by yourself or with friends. Those are the things that take the first steps.
That's great. And now I'd like to thank you for joining us tonight and taking the time out of your schedule to help educate all of the people who have joined us tonight. You can see Dr. Dawson's contact information on your screen there. And then just these programs always have a lot of planning, coordination, and teamwork that gets done behind the scenes. And so I'd like to thank Suzanne Plaskett-Bauer and Lauren Clinton for their silent work that they always do for helping us put these programs on for you. Dr. Dawson, do you have any closing remarks?
No, I think that I hope everybody has a safe and enjoyable evening. I do encourage everybody to, sign up for a COVID vaccine if it's appropriate for them. I'm a big advocate of that because it can help to, slow the progression of disease and also can prevent yourself as well as family members from getting sick. And then from a cardiac standpoint, I think I really just hope that you take the information from tonight and motivate you to be the best version of you. And not to be embarrassed, to make yourself a priority. You can't always take care of everybody because you got to make sure you take care of yourself first so you could be there for everyone else later.
Yeah, that's very true. And having worked in the vaccine tent today, I can tell you that people are excited about getting it for the most part, so that's really good. And with that in mind, remember to wash your hands, wear your mask, stay 6 feet apart. We're not at herd immunity yet, so we need to just continue to keep safe. And again, thank everybody. I want to thank everybody for participating with us tonight. As we mentioned earlier in the program, our next webinar is called a Health Bite, where we're taking a little 30-minute part of the day around noon. And the next one is on February 25th, and we'll be talking about working from home in the pandemic. So thank you all for joining tonight, and be safe.